Do you want to reduce your breast without any scars or minimal scarring? Okay, so today we'll be talking about breast reduction surgery. It's also very common as breast augmentation. So the treatment of each breast is different. And as a surgeon who does breast surgery, you should be able to cater your surgery depending on what type of breast condition you have. And it also allows you to reshape your breasts from a long hanging structure to round structures on your chest. Do you want to reduce your breast without any scars or minimal scarring? Okay, so today we'll be talking about breast reduction surgery. It's also very common as breast augmentation, which is enlarging the breasts. Breast reduction surgery is also a very popular surgery in time. Sometimes when you gain weight or after breastfeeding, the breast loses its shape and it goes down. So there are different ways of addressing this one because there are different severities of breast in general. Some are more sagged, some are less sagged, some just deflated. So the treatment of each breast is different. And as a surgeon who does breast surgery, you should be able to cater your surgery depending on what type of breast condition you have. First, let's talk about what is breast ptosis or sagging breast. So if you say ptosis, it means that the breast have drooped down or sagged down. So it lost its conical shape, which it was originally like a mound. The elastic fibers already have been destroyed, maybe because of stretching, from post-pregnancy, from breastfeeding, from aging. Then the structures that hold the breast as a conical shape will also be the ones that will be stretched too much and it will sag down. There are different degrees of sagging, and this is measured or graded depending on how severe. One is the normal breast. As you can see, in normal breast, the nipple areolar complex or your nipples in general are above the inframammary fold, in the center of the breast. Your inframammary fold is that fold where the breast touches or meets your chest. So where the breast would take off from the chest wall. This is a very fixed structure because it's adherent to your chest. So it's very consistent even if you have drooping and everything, that inframammary fold more or less fairly stays consistent in location. So this is a good reference point where you will measure the degree of sagging. So normally the nipple areolar complex is above this fold. In time, the nipple areolar complex can droop down and fall on the level of that inframammary fold. If the inframammary fold is at the level, or if the nipple areolar complex is at the level of your inframammary fold, then that's a grade 1 ptosis or grade 1 degree of sagging. So this is considered a mild sagging, and sometimes you can get away by putting a breast implant and it lifts everything up and then you're done. Very easy job. In times, the nipple areolar complex or nipples go down below the level of your fold. So that if it's below the fold, that's a grade 2 degree of ptosis. And if it's really well below the inframammary fold and the breast is hanging and the lowest point of your breast is the tip of your nipples, then it's a grade 3 breast ptosis or sagging of the breast. So in grade 2 and 3 breast ptosis, your traditional breast augmentation or minimal breast lift like your donut mastopexy may not be the best solution, or in most cases it might just make things worse. So in second and third grade breast ptosis, the solution would be a breast lift. So what is a breast lift? A breast lift with reduction is you remove some of the excess skin that is drooping, because mostly it has already developed excess skin, and you remove some of the tissues that are sagging, or you remove most of the breast tissues that are involved in the sagging. So this reduces the size as well, and it also allows you to reshape your breasts from a long hanging structure to round structures on your chest. So through time, there was different techniques that were developed to do a breast reduction. One is the classical wise pattern, or also the anchor pattern. This is the original. It removes the breast tissue and skin all together, and the nipple and areola is placed in a different location. I'll go to that after. So another pattern is you have your snowman or your keyhole. So what is the something in common in these three patterns is you have a vertical scar. A vertical scar going below your areola all the way to your inframammary fold. It may be good, it may be well hidden, especially if you have a bra underneath. However, if you have pigmented skin, if you have colored skin, brown skin, Asian skin, sometimes the scar would not look good, and you would have a very visible scar on your breast. And one solution for this one is horizontal breast reduction. So the horizontal breast reduction also reduces the breast tissues, it removes some of the skin, but the incision is placed on a horizontal plane. So the incision would lie under the breast, well hidden in plain view. Only you can see it, or if you put up the breast, you can see that scar. But it feels really good, and because the vertical component is eliminated, even in pictures, you could not see that vertical scar, which is the most common complaint when it comes to the traditional breast reduction. And the nipple areola complex in all of these procedures are repositioned using a pedicle. So again, what is a pedicle? So because you cannot just transpose the nipple and areola complex, you have to have blood supply. So this blood supply comes from different arteries from your breast. It can come from an artery in the medial portion of your breast, going from the under part, or it depends on your surgeon where he will base that blood supply. But in general, you preserve that blood supply so you can reposition the nipple areolar complex to another part of your breast, usually in the middle of your new breast. However, there are times that the breasts are too large, in grade 3, or those that would have very, very heavy breasts. So what happens? The distance where the artery will travel from your body to the nipple will be very long. So the chances of necrosis or inadequate blood supply to your nipple is higher, especially if the breasts are very large. In this case, a more consistent approach would be a free nipple graft. So a free nipple graft, if he is removing the nipple and the areola as a dermal graft or skin, it's just with no blood supply, and it's reimplanted on your chest wall or on the breast. So that free nipple graft will stick to the skin and eventually would be your new nipple. So that's a difference. So it avoids the complication of nipple necrosis after breast reduction surgery. So this one can be discussed with during consultation, because different breast conditions require different kinds of surgery. So in short, the horizontal incision is a modification of your traditional breast reduction procedures. What are the complications that or the difference between traditional one, horizontal incision breast reduction? Sometimes the breast may appear a little wider or boxy, that they say. However, this is surgeon technique, and this can be avoided by careful planning and drawing of the new shape of your breast. Usually by extending the incisions sidewards, you remove some of the breast tissue there, so you can still retain your round breast look or naturally looking breast. Sometimes if you have a lot of fat on the side under your armpit, this may be also removed by liposuction, so at least the fat there will not contribute to wide looking breasts. So it's a case to case basis, and me as a surgeon who does breast reduction surgery, I would always advocate something that has been consistent, has the less downtime and less scarring, especially in pigmented skin, which scarring is always a problem. So we try to hide your scars. Recovery of this surgery is quite fast actually. And the surgery may take between 2 to 4 hours depending on the size of your breast, because the incisions are very long, and sometimes it's very meticulous to close the skin. It can take up to 4 hours for the surgery to be done. However, right after, this is a day surgery. You can go home right after the surgery, and you will go home with some drains, and these drains are removed. The soonest is around after 48 hours if the drain is not draining anymore. Usually with drains, it heals faster and prevents any formation of excess fluid and blood under the breast. And then after the drain removal, most can go back to office work in a week's time. More or less, that's how the breast reduction surgery recovery goes through. In 2 weeks, if you're from out of the country or if you have to travel, riding a plane or going back, that means we won't have immediate follow-up anymore. I would recommend at least 2 weeks post-surgery before any flying out of the country is done. And then some restrictions on activity may also be, I always encourage you to ambulate, meaning you walk around. You can help yourself, go to the toilet, bathe yourself, walk around, except for heavy exercises like going back to the gym, lifting heavy things, meaning something more than 20 pounds using your upper body, then that may wait at least a month's time. Some people, they ask, when can I drive a car? And I say, most of the time in 1 to 2 weeks, you can already drive yourself. You can already help yourself. And this won't be a real problem. And pain after the surgery actually is very tolerable, and it can be controlled with pain relievers. On the average, pain is reported between a scale of 1, as 1 is the least pain and 10 the most painful, would be between 5 to 7 depending on how you tolerate. So after drain removal, I'll see you again for checking of the wounds if everything is healing fine. And usually after a week or 2 weeks, if everything's okay, then you're free to go. And usually if you have there are complications like infection or dehiscence or opening up of the wound, usually after the first week you can see that already. But again, this is another advantage of the horizontal incision breast reduction, because it's just one line. It's one horizontal incision. It heals faster. Unlike those that have wounds that intersect, like your Weiss pattern, that intersection of the horizontal and the vertical part, that letter inverted T, or in the snowman where the wounds are intersecting. So meaning it's not just one line. You have a scar going this way and a scar going that way. It heals longer, and that intersection has the least blood supply. So that's the area that would mostly dehisce. That's the area that would mostly not heal as fast as the others, and it's also the area where you might have the most amount of scarring. So this one is a very simple, a lot simpler technique. It's easier to close, it heals faster. Chances of complications are even less. If you would like to have a consultation and are interested with any aesthetic breast enhancement, be it augmentation with implants or breast reduction surgery, please feel free to contact us for a consultation. And if you want more content like this, please comment below and subscribe to our channel.